Hey, welcome back, everybody. Time again for this weekly journey we call Living Hope. Your journey with pancreatic cancer. A weekly show designed to provide hope, inspiration, and education like we're going to provide today for those living with pancreatic cancer. Sharing the real-life stories of those really affected by this deadly disease and how they deal with it on a daily basis. With a woman, well, she has a little experience with that here today.
Just a little bit, I think.
Just a little bit, 20 plus years here or something?
23, so that's not too bad, I guess.
All right.
I actually just met somebody, hopefully they'll be on at some point, that's a 33. So,
wow,
yeah,
okay.
So we'll have them on. But today I'm really happy we have joining us is Chelsey Torres, a board-certified genetic counselor with Hoag Hospital. Thank you, Chelsey, for being here today. We really appreciate it. And what we're doing is we're actually kicking off a 3-part series with Hoag Family Cancer Institute. And today's topic, we're going to be talking about the genetics of pancreatic cancer. So Chelsey, thank you for coming. We're happy to have you here.
Thank you so much for having me. I'm excited to...
Can I start with one question that we used off air here? You told me when I met you years ago, Roberta.
Yes.
You had what? Mother and I forgot how the family members.
I had my father and my mother, my uncle and my grandmother all died from pancreatic
Okay,
cancer.
pretty strong genetic connection, you would think. But when 20-some years ago, when you thought you might have it, and you insisted that they look into this, they told you what?
They told me not to worry about it. I was too young and it wasn't hereditary.
It was not hereditary. So I'm taking it that Chelsey's going to say that's not correct anymore here.
Well, hopefully she's going to set the record straight and we'll get some truth and some facts. And at that time, maybe that's what they believed. And though I do hear that a couple of times still, but we're going to quash all that and have Chelsey set us straight. But first, I would like her to, because I do get this asked all the time, what is pancreatic cancer?
Yeah, so there are 2 different types of pancreatic cancer, commonly referred to as pancreatic adenocarcinoma. That would be most pancreatic cancers when you hear people say pancreatic cancer. The other type is pancreatic neuroendocrine cancer, but less than 5% of pancreatic cancers are neuroendocrine. And it essentially depends on the different cells in the pancreas of where the cancer is occurring. And sneak peek into our 3-part series, Dr. Jimmer is our expert on this, so he can get even into more details than that on the specific cells of the pancreas.
And what kind do you have, Roberta?
Well, I'm an odd bird. I have this slight combination.
We knew that going in. You didn't have to preface it by saying that. Right?
Well, I thought I would start off that way so nobody is too shocked, but apparently I present with both types, which is a rare, either, I believe, 3, 4, 5%, something like that. So. And at the time when I was first concerned about it is when I had lost 3 family members. My mom was diagnosed while I was receiving treatment. And my dad and his family had the endocarcinoma, and my mom had the neuroendocrine. The endocarcinoma, is that what they refer to as PDAC sometimes?
Yes.
Okay.
Yeah, exactly.
Okay, just want to make sure in case that pops up that we know. I'm not sure, but just in case. So when we hear about the terms like hereditary, familial, and sporadic, I think it is. What do these mean, and what's the importance of knowing the difference, and is there a difference?
Yeah, that's a really important thing to distinguish for people, and usually one of the first things I start with when someone sees me for genetic counseling for pancreatic cancer. We talk about how, correcting the statement from before, about 10% of pancreatic adenocarcinomas are hereditary, meaning they were caused by a mutation in a single gene that put that person at higher risk. So usually in our hereditary families, we tend to see multiple people diagnosed with cancer, younger than average ages at diagnosis, more rare cancers in the family, so pancreatic, ovarian, men with breast cancer, things like that. And that's our hereditary group. In terms of sporadic, that would be pancreatic cancer that just happens by chance. So there's no gene mutation involved. It could be due to things in that person's environment, so lifestyle related, chemicals they were exposed to, things like that. Usually in the sporadic families, the pancreatic cancer might be diagnosed later in life, and it might be the only person in the family with no other cancers in the family. That'd be a typical presentation of sporadic. And then familial, this is sometimes where people get tripped up with the hereditary familial. So familial means pancreatic cancer appears to be running in the family, but we can't find a gene mutation to explain why. So there's too many people in the family to have it for it just to be by chance, right? With pancreatic cancer being a rare cancer, only like the average person's lifetime risk is about 1.7%. When we see a family like yours, Roberta, with you and parents and uncle and grandparent, that's too many just to be random, right? So we think there's something going on there. Either it's a mutation in a gene we haven't discovered yet, it's something that you're all sharing in your environment that's putting you at higher risk, or it's a mutation in one of the genes we do know of, but it's not detectable by our current technology. So those are the families we have to be really careful with, because we can't necessarily use genetic testing to see who's at risk and who isn't, because clearly it's running the family, but we can't use genetic testing to figure out who's
So
at
I
risk.
got to ask another question. So have you ever looked into genetic testing? Do you know which case, whether there's a gene mutation that runs in your family, or whether it was just all the other things she said here?
By chance, look at the draw.
Yeah.
Actually, yeah. So I've had genetic testing 3 times, and they've all come back inconclusive. So we were just talking. My last one was 5 years ago, and I think things have probably changed since then. So I probably will be up and doing it again. It's just something I think to know, because it's like, with so many family members, especially on my dad's side, how can it not be hereditary?
Right.
But to be able to come up and say, it's inconclusive for that many, it's just got to be something. Because I know, as far as lifestyle, my dad was raised on a farm. We did pass missile testing areas, which we were told had nothing to do with anything. But just to find out, I think, to know why or what. So is there something we can change? For, like I said, I have 2 sons.
Right.
Is there something they can change in their lifestyle now that may be effective if they decide to have children somewhere down the line, or for themselves?
And I'll ask one more question. I'll try not to keep asking questions, but you mentioned once before in an episode a long time ago that you have 2 sons. One wants to know, one doesn't want to know. If I got that correct?
Yes, pretty much.
So is there a difference if you know? I mean, you just, if I have a genetic predisposition for something, so what? Does it just make me worry, or is there something I can do about it?
Well, I think for me, it would make me want to do something. I mean, I think not knowing is more worrisome, because then, it's just something that I think, at least if I know that it's there, then, okay, if I want to make my lifestyle changes, I can do that. I have that opportunity. Whereas if I didn't know, then, or if I just put my head in the sand and don't want to know, for me, that's just really hard. Because if I can make a change in something that might make a difference, it might make I still might get pancreatic, of course, I still might get pancreatic cancer. The person still might get it, but maybe they would make a decision that would change their lifestyle, that would make diagnosis easier, would make treatment options easier. And I don't know, as a genetic counselor, if you see that, or am I totally off wing somewhere
No,
there?
you're completely right. That's a big goal for us with genetic counseling and testing, is the idea of prevention and early detection. Right? If we can use this testing to figure out who's at higher risk, or if we can use family history analysis to say, you have 4 people who came before you who had pancreatic cancer, your risk is probably higher than average. We can then give them exact estimates and ideas of, okay, based on your family history, you should start screening at this age, or based on this gene, you should start screening at this age. And there are these pancreatic early detection programs that have popped up all over the country, where they've developed protocols for when people go in. You can get imaging done, you can get blood work done to check for markers that may be related to hopefully earlier stage pancreatic cancer, to try and catch it at an earlier stage, not later stages, because unfortunately, as I'm sure many are aware, the signs and symptoms aren't always super obvious at the early stages, and it's often caught at these late stages, which is why it makes it so aggressive. So if you know you're at higher risk because of a gene mutation or because of a strong family history, you could consider enrolling in these sort of screening programs for early detection.
Now, if you go in and you find, okay, there is a gene mutation, is there anything you can do as far as lifestyle, diet, to change that, or are you just pretty much stuck with what that is?
That, it doesn't hurt. So it definitely helps to have healthy diet and lifestyle. As we know, some of the other risk factors for pancreatic cancer can be things like obesity, older age, things like that. So improving lifestyle in other ways is helpful, and that's something that is discussed in the screening programs, like what other things can you do in terms of your diet and stuff to lower risk.
Right, anything you can do to hopefully make it better, right?
Yeah.
Because we don't know all the time what we're going to get, so it's if we can just, and it's kind of hard, because I mean, I've known so many people who have led, if you want to say, the perfect lifestyle. They don't smoke, they don't drink, they exercise, they eat properly, and they still get pancreatic cancer. And it's like, you have somebody else that just throws everything to the wind, and which I'm happy they're healthy, but it just, you try to make some sense of it, I guess.
Right.
And it's difficult sometimes.
Totally. And we don't fully understand that. Like, some of these genes, the studies show, okay, you have a mutation in this gene, your chance in your lifetime of getting pancreatic cancer might be 10%. why do 90% of people with that gene mutation not end up getting pancreatic cancer then? And why do some do, like you said, even when they seem to be doing everything correct? So it could be other genes that are playing a role that we don't fully understand yet, or environment and things beyond our control.
I know the BRCA gene is pretty common, I guess, in pancreatic diagnosis, but that's you find that in breast cancer as well, right?
Yeah, so most of the pancreatic cancer predisposition genes are associated with more than one type of cancer. So essentially, when these genes work properly, they are actually called tumor suppressor genes. So these genes provide instructions to your body, just like there's genes that provide instructions for eye color. These genes provide instruction for how to prevent these different types of cancer. So when the BRCA or BRCA genes are working properly, they're supposed to be telling your body how to prevent breast, ovarian, prostate, pancreatic cancer. But if someone inherits a faulty BRCA gene, or a gene with a mutation in it, then it's like there's something broken in that instruction. So your body's sort of missing that instruction, and it leaves it more susceptible to these different cancer types.
Yeah, I've known a few that actually had breast cancer first, and then unfortunately got pancreatic cancer.
Right.
And that's because they share that common gene.
Yeah.
And is there any way, like, okay, if they're diagnosed with breast cancer at some point, then should they start watching maybe for pancreatic, or is that a little bit far-fetched?
Only if they have a gene mutation confirmed to link the two together. So other gene mutations like PALB2 or ATM, in addition to BRCA1 and 2, these are other genes that do link breast and pancreatic cancer together. So if someone has a mutation in one of these genes, we would also down the line start watching for pancreatic cancer. But if you just have breast cancer, your genetic testing is negative, it does not mean you have a higher chance of getting pancreatic cancer one day.
Okay, I had somebody actually tell me, please ask her this, because...
No, it's a good question.
Yeah.
People ask that all the time with breast and ovarian cancer. They say, just because I have breast cancer, do I have a higher risk of ovarian cancer? And the answer is no, unless you have a mutation linking the two.
Are ovarian cancer and pancreatic related in any way that you've seen, or is that different?
Through some of these same genes, yeah. BRCA1 and 2 could also put someone at higher risk for ovarian cancer. So for a lot of these genes, we discuss ways to reduce risk, right? Whether that's screening for breast cancer sooner, or sometimes women who are at higher risk for ovarian cancer will consider removing their ovaries and fallopian tubes once they're done having kids or in menopause. You can't do that with the pancreas, right? We can't just remove that one prophylactically. So we need other strategies to try and catch that one early.
Yeah, unfortunately, you can take it out, but
right. We don't
not
necessarily
the best.
want to do that for no good reason.
Right. So do you know approximately how many cases are hereditary?
With pancreatic adenocarcinoma, about 10%, or 1 in 10, turns out to be hereditary. But if someone has an additional family history of pancreatic cancer or other types of cancer, the chances that we're going to find a gene mutation are probably higher.
And in gene mutation, once it's identified, how does that affect the patient's treatment?
That's a good question too. So that's another reason people like to do testing, because there might be a targeted therapy or a trial that they specifically qualify for because they have a certain gene mutation too. So I always tell people, I'm gonna send your results to your oncologist just in case it would change their plan with regard to treatment or therapy, but they obviously know the pathology of your tumor best, and they're going to pick the best option. This is just another tool that they could use in terms of possibly a great treatment for someone.
In some families, I might have already asked this, so I'm sorry if I'm asking again, but somebody's just texting me and asking me this. In some families, pancreatic cancer runs in the family, but no gene mutation is found. What might be happening in those situations?
Those would be the cases where either it could be something shared environment related, right? Sometimes I see families where we don't find a mutation and they say, oh, we grew up next to some radioactive power plant, or we lived in the orange groves and they sprayed pesticides every day or something like that. So it could be that shared environment piece, or it could just be a gene we don't know yet, right? So our genetic testing has changed a lot over the last 30 years. Like in the early 2000s, we were really only testing for BRCA1 and 2, and now we can test people for over 80 different hereditary cancer genes. So not just pancreatic, other things as well. So it could be we just don't know the gene yet, or it's not available for clinical testing.
Do you have advice for somebody that once they do the testing and they do find out what they are carrying, what they can do or what they should be doing?
If a mutation is found, there are National Comprehensive Cancer Network guidelines for most of these genes that say what age to start screening, what type of screening to do, how often to do it. So we usually follow those guidelines pretty closely and try and send people to high-risk programs that are designated to following people who are at higher risk for that cancer. If they do the testing and nothing is found, but they still have a strong family history, they may still qualify to do some of these high-risk things, right? So like in your case, I know it was many years ago and they said it's not hereditary, don't worry about it. But if I saw you today in my office and you showed me your family history and your testing came back inconclusive, I would say, I'm still worried about your risk because of this history. Please go to our pancreatic screening program. They're going to check your pancreas at least once a year and follow up in that way. So.
Do you want to talk a little bit about the screening program? I know we're going to talk more in depth, but since you brought it up, and in case I get a question, do you want to just kind of tell us a little bit about that?
Of course. So the screening programs might be different from place to place where you're going for your screening, but at our screening program, we have patients come in once a year. They meet with a nurse practitioner. We review their family history, the current guidelines, and then the appropriate screening is ordered for checking their pancreas, whether that be an endoscopic ultrasound or other imaging, a panel of blood work to check different markers, with the hopes of, if anything looks abnormal, we can intervene further in these people who we know are at higher risk, right? Doing this type of screening for everybody in the general population every year doesn't necessarily make sense, but if we screen the people who are at higher risk, hopefully we can get some early detection.
Pause question.
You mentioned blood work. That's come up a lot of the show. Aggie Hirschberg is a big supporter, believer, gets behind the Hirschberg Foundation up at UCLA, and said they're getting close. I can't tell you who or what or how, but it's more likely than not that they're going to come up with a blood test. There is no blood test though right now. You could. So what are you screening when you say markers or something? I thought that was one of the things missing. Unlike prostate cancer, others, I go get blood work and they say, "Oh, this doesn't look good." Is there some markers? Is there a blood test coming, and are there markers they can look at now?
Yeah, there's not necessarily something that you'd think of that's exactly comparable to like prostate cancer screening and the PSA. They're looking at other things. I might leave that a little bit more to part 2 or 3 of this series. Some of our doctors who are coming in. No, exactly. They can maybe speak more to exactly what they're looking at and what different levels mean more than I can. But yeah, hope for something like the PSA would be amazing.
Because then you'd catch it earlier.
Right. Yeah, with a blood test, which is not that invasive compared to some of the other things.
No, you can take a big vial and test for a lot of different things, right? So there you go. It'd be great. So for genetic testing, though, I mean, can you only get this like in big areas, or do like my family came from a small town? Would that be something that would probably be available to them or not, or they need to go to a bigger city area, or how does that work?
Yeah, you may hear more about it in more city type areas, but it definitely is something that's available to everybody. You just have to find a way to access it. So essentially, again, the National Comprehensive Cancer Network guidelines recommend that everyone diagnosed with pancreatic cancer be offered to do genetic testing and counseling if they want. They also recommend that first-degree relatives be offered genetic counseling and testing. So a first-degree relative would be someone you share 50% of your DNA with. So your siblings, your children, and your parents. And then if you have a second-degree relative with pancreatic cancer, like a grandparent or something, you may also qualify if there's other cancers in your family.
And you say qualify, so does that mean money? Somebody pays for it?
Yeah, typically insurance. Most insurances will follow these guidelines. So if you have it or have a first-degree relative with it, the test is more likely to be paid for.
Because if you don't, then you got to pay for it out of pocket. And I thought Roberta said once upon a time it's expensive.
It can be expensive. It's got a lot better. So some of the cancer genetic testing labs we use offer testing in the range of like around $250, but it depends obviously where your genetic counselor sends the test to. Lots of the labs have financial assistance programs to help with cost if someone qualifies. But yeah, the 250 range is a lot lower than what it could be.
I thought it was like thousands or something. Is that what it used to be or something?
It used to be.
Yeah, that's when we first did it. It was in the thousands.
And so if someone wants to do this, the best way to find a genetic counselor is a website we have. It's findageneticcounselor.org.
That's too complicated, but say that again. Findageneticcounselor.org, and they can go nationwide and put in a zip code and find one.
Exactly. Go to the website, you put in your zip code, you click the specialization you want, because genetic counselors do specialize in other areas like cardio genetic testing. So you click cancer, and then you can try and find someone close to where you live. Some genetic counselors can even do the appointment over telehealth. So you just have to find someone who's licensed in your state. So if you do live in a small town and you're several hours away from the nearest city, you might be able to do a telehealth visit.
Wow. Okay.
And then they could arrange for you to have your blood drawn somewhere or do like a saliva collection sample in that way.
So I'm coming in to get my genetic testing. What happens?
So before your appointment, we typically have people fill out a family history questionnaire. So we ask you about everybody in your family, how many kids you have, how many siblings, aunts, uncles, how old they currently are, or how old they were when they passed away, what type of cancer they had, how old they were when they were diagnosed. And before you come in, we analyze that. Plus we analyze your personal history, if there's any risk factors there or history of cancer. When the person comes in to meet with us, we review that with them. We go through their family tree person by person, make sure everything's correct. We analyze it for any patterns for certain hereditary cancer syndromes. We discuss the genetics of pancreatic cancer. So we talk about what percent is hereditary, what some of the other risk factors are. We go through how genetic testing works, how we analyze these genes to check for mutations or errors, and if we find a mutation, what the risk is to family members. And then we decide what the most appropriate test is, right? As I mentioned, some of these tests are very large, and you can test for genes related to cancers that aren't necessarily in your family, right? So if you come in, I might offer you testing just for pancreatic cancer genes, or we could also throw in breast cancers and colon cancers and brain tumors, and we can kind of talk through what you want to know, essentially. We sign some consent forms, we draw the blood, and then usually it takes about 2 to 3 weeks for us to get results back, and we can call people or meet with them again to review their results.
Oh, 2 or 3 weeks. That's not too bad, actually.
Not too bad, yeah.
When, I'm sorry, I just lost my train of thought.
So once somebody gets this and it's a positive,
Yeah.
they said you have a gene mutation, what do you do?
So then we're going to go through risks, right? So we might say, okay, this gene is linked to pancreatic cancer and melanoma. There's a gene called CDKN2A. It's a pancreatic cancer melanoma gene. So we're going to say with this gene, your risk of pancreatic cancer in your lifetime is greater than 15%. And based on this gene, we recommend starting screening for pancreatic cancer at age 40. So we'd have, if they're over 40, we'd enroll them in the pancreatic screening program. If they're under 40, we would give them the number to call when they turn 40.
So they could find it sooner, because that's,
Yes.
as I understand from years of doing this now, the number one reason the death rate is so high is it's not diagnosed early enough, because
Correct.
you don't know where the pancreas is, the symptoms could be anything, and it's the last thing on the list when the doctors check. They go through rule out everything else before they say maybe it's pancreatic cancer.
Exactly, yeah.
And then to get other family members enrolled, how does that work? And do you help, like if you have somebody, like I said, who may not want to have it done, are you
Like
able
your
to,
son.
are you able to kind of sit down with them and just explain, maybe the process, maybe that's what they're afraid of? Or,
Is he listening today here? Can
Who
we
knows?
look to the camera and do a direct appeal to him?
So genetic counseling is considered a non-directive healthcare profession. So I am never in a position where I'm trying to convince someone to do the test. My job is to explain it, go over pros and cons, talk about what matters to that person, but never force someone to do the test, right? But yes, in terms of family, when a mutation is found, genetic counselors will often write what we call a family letter. And it might say something like, someone in your family did genetic testing. They found a mutation in gene X. It causes this. Here's how to find a genetic counselor if you want to be tested. If you have a mutation, the chance that your kids and siblings have it is 50%. So people could consider testing. Anyone who tests negative, if you don't have a mutation, you cannot pass a mutation onto your kids. Right? If your genes look perfect, you can only pass on perfect genes to them. So
My kids would love that. They tell me I don't have perfect genes now, so that would be wonderful.
right?
And that is good, because it's sometimes I think it's just a matter of sitting down and understanding, what it is. So, and not that you don't ever want to force anybody to do anything that they don't want to do, but something somebody is just asking too, the more that you test for, does that increase the cost of the test itself? or is there like you get 5 for a certain
Yeah.
amount or something? You know?
Not
Today's doing a
usually.
bargain. You get 5 for one thrown in for free, 2 for 1.
Do
Yeah.
we get any twofers in here? Or,
Yeah,
or how
it's
does that do?
usually so the self-pay prices for the test are generally a flat rate. So you can include all the cancer genes or you can include some of them. Generally a flat rate in that couple $100 range. Typically that's also the same when you're using insurance. Usually if insurance will cover a handful of the genes, you can add on the others for no extra charge, but everybody's insurance is different, the labs are different, so it depends where you're going to get your testing, but we usually have pretty good success with getting a full panel for no extra charge for most people.
Oh, that's great because well, for me, like I said, I would want to know every little thing that's in there just in case. Maybe there's something I can do.
Some
I don't
people
know.
say, I don't want to be surprised again. If there's a higher risk or something else that I can prevent or catch early, like I'd like to know. And then other people don't want to know, which is okay too.
Yeah, you have to accept if there's something they don't want to know. You can't force it because everybody has to be able to live with it. And
Right.
I have found, like I talk often, is I don't keep track of my numbers, my tumor marker numbers, because I saw too many people who that just became their main focus. So I let my doctors worry about my numbers, and I just do what else I need to do. But for somebody then coming in. So the first step they would need to do is to find out if there's a genetic counselor in their area. Is that their first step?
Yeah, in their area or someone who's licensed in their state that could do a telehealth visit.
And would they do that? Like, I hate to use Google, but would they go online, talk to a doctor? How do they find you?
Yeah, you can find me through the findageneticcounselor.org.
There we go.
You can ask your
Roberta
doctor.
wasn't listening earlier.
It's okay.
Findageneticcounselor.org.
No, I wanted to get that website
that's-
out there again.
yeah.
It's important, see?
One more plug for findageneticcounselor.org.
Yes.
Or you can ask your doctor for a referral to a cancer genetic counselor. They'll hopefully refer to one who's in network with your insurance or local. That's another way to find us.
Can I ask you a controversial question? We'll end with one little controversial one here.
Okay.
Roberta has said through the years,
Uh-oh.
and I tend to agree, that not all the doctors are tuned into pancreatic cancer. They don't know enough about it. They haven't dealt with it before because it is numerically not one of the bigger cancers. It may be one of the deadlier ones, but it's not one of the ones they see very often. And so they tend to dismiss it or not think about it. Is that changed? Is that true? And if so, is that getting any better? Are they getting more aware of pancreatic cancer?
That's hard to say. I guess my only perspective for that is when I meet with patients who either have pancreatic cancer or they tell me the story of their relative who had pancreatic cancer. And the stories I hear are always difficult because it is a cancer that's often caught late. So they tell me stories like, yeah, my dad had all these symptoms on the list. He had the itchy skin, he had this and that, and no doctor jumps from those things to cancer right away. So it's a tough one. I hope some doctors are getting more aware of some of these things, but it's always hard being the one who meets with these people who get to tell me their story of their family history, and it sometimes is unfortunate if it wasn't caught
So
early.
if you do have what you think might be a tendency, a family history, it would seem logical then to take control of your own destiny here and do the extra work beforehand so you can say to the doctor, hey, I've already been tested and I have a gene mutation or whatever here.
Right, yeah, you have a gene mutation or you have a family history, so genetic counselors could probably give you a general lifetime risk idea, even if there's no mutation involved. So, Roberta, for example, if we saw your sons, we could plug your family tree into a computer model, everybody with pancreatic cancer, what age they were diagnosed. We can put in that the genetic testing was negative and say, okay, what's his risk just based on having this many people in the family? And use that number, and then we try and equip people with, okay, here are the signs and symptoms, here's your family history. We don't want to worry you, but we do want to help empower you to be an advocate for yourself. So if some of these things come up and your doctor dismisses you, you can remind them that you have this family history, this predisposition, and
I got a test,
yeah,
and look
and
what the test said, yeah.
Right, and I want to get screening or that sort of thing.
Yeah. You brought up something. So when you're hearing all these stories, how do you deal with this? It's got to be an emotional. How do you cope? How do you deal with all this?
Yeah, that's a good question too. It is hard. We do see people who are in really tough situations in their families, and it is sad to hear those emotions, and the stories stick with me, and I remember the names of these patients too. And I think it just, for all the sad, you also get a lot of positives. You get a lot of people who are grateful for the information. You get people who tell me, I'm so glad I got to meet with you. I found this information. My daughter's not going to have to deal with this. years from now because she found out about her risk and took measures to lower it or things like that. So it can be rewarding in that way, mixed in with all the sad and hearing the stories and just making you want to continue this work and help people in any way you can. That's kind of the goal. And
you said something I have to pick up on. You remember their names. All of us in the outside the medical world have a tendency to think you look at us all as just case numbers, not as people, particularly giant hospitals. And you're saying, no, we know your name. We remember your name.
Yeah, there's the stories that stick with us, the names that stick with us. Genetic counseling, you get to spend more time with a patient. That was something that drew me to this field, right? Sometimes in certain fields, doctors don't have a lot of time from patient to patient, but genetic counseling, we meet with you usually for around an hour and talk about your family history. You know, we go through all this information, we get to know you a little bit better, we're following up with your results. If you have an inconclusive result like you did, Roberta, we might call you in 5 years if it becomes clarified. Like we keep track of that. So we do get involved with these families. And if we're seeing family members, if a mutation is found and we're meeting everyone's kids and their siblings, and you're not going to forget those families.
Well, I thank you for coming, and I think we could probably go on more. Maybe we'll have to do more segments with you. But just before we leave, is there anything that we maybe didn't cover that you think is really important that you just want to leave a last minute?
Yeah. The only other thing I was going to mention is the PROCEED study. So proceedstudy.org is the other website I wanted to leave people with. That's
Perceived like a...
PROCEED.
Would you want to spell that?
Proceed. Okay.
Yeah.
Proceed.
So proceedstudy.org, that's where you could find sites that are doing pancreatic screening programs. So if you have a gene mutation or 2 or more relatives with pancreatic cancer, go on there, find a clinic near where you live, and you could get this sort of specialized screening, and it contributes to research. That's where you could find a program like that.
Yeah. Well, thank you, and we will be talking more about that in future episodes. But like I said, I'd love to have you come back again sometime as well. But as long as you speak my name, I shall live forever. Today's episode is lovingly dedicated to all those lost to pancreatic cancer who carried a hereditary gene mutation, and to the families who keep their memory alive. Thank you.
Well, another powerful example of why you should tune in each and every time. You never know what you're going to learn or what you're going to hear or who you're going to meet. As we take this journey together, we call Living Hope, your journey with pancreatic cancer. If you have somebody you know that has pancreatic cancer, sounds like a pretty simple way to do it is to start off by getting genetic testing. If somebody in your family, rather, go find out. Go see if you qualify and find out rather than wonder. Find a genetic counselor. Findageneticcounselor.org is the place to go for that. And if you want to know more just in general, come back. We tell stories like this every week right here on Orange County's only community radio station, OC Talk Radio.